Hello, CNAs. Welcome. My name is Chu. I'm a CNA, PCA, medical assistant, whatever you want to call it. I want to talk about our vitals and how critical it is and how important it is to report our vitals, including blood pressures, blood sugars, respirations, and heart rates. Um, I do work a lot, so I split that in two parts, but I'm going to put it in one video. So let's get started. Today we're going to talk about critical results when to report our blood pressures and blood sugars. Okay. First of all, we're going to report blood pressures, and that's the high blood pressure, the hypertension. For well, on my research, the critical reading is 180 over 110. Um, for me, I will report 150 over 90 because that's just to prevent hypertension causes vision loss, heart disease, and stroke, of course, and it could lead to death. Um, so that's when I report 150 over 90. Okay. And for the low, the hypotension, I will report 90 over 60. The reason being is it could cause dizziness, unconsciousness, pass out, and lead to death. Okay, so that's what we're gonna do. 90 over 60 is when I report. And then for the blood sugars, for the high blood sugars, I will report 150 or higher. Because for hyperglycemia, it could cause blood vessel nerve damage, blindness, kidney disease, heart disease, any other organs. Okay, and then so it's critical to report. So for the low blood sugar, I would report something under 60. Or if you feel comfortable, you can report something under 70. And so hypoglycemia can cause people to pass out, coma, seizure, and lead to death. Okay, so but then there's a lot of patients that are NPO, so you don't just shove the juice or the soda to them right away. You call the nurse right away, stand with the patient, and if they don't text them, call them, and if you can't get a hold of the nurse, get a hold of the charge nurse. You gonna get a hold of someone one way or the other. Stay with the patient, and if they say give him this and that, then you can give them whatever they want you to give, and then check in 15 minutes after they swallow the juice or the soda. Otherwise, if they're NPO, the nurse will come in there and take over. Nowadays, in a large hospital, big hospital, they will give us iPhones, to communicate. So it's easily for you to call them, communicate with them, get a hold of them. If not, I will do the old-fashioned way: pick up the unit phone and dial their number, whether they're in the room or not. So, anyways, it's just something to help you, to help the patients, to keep them safe, to prevent them from stroke or heart attack because of those results. Okay, who knows? Things change dramatically. 1 minute the patient is fine, the next minute they are not fine. Like in the morning vitals, they are perfect. But at noon when you go, they drop down, or either the blood pressure got so high that it's so dangerous. So it's really critical to let the RNs know in real time and in a timely manner. And like I said, stay with the patient. It doesn't matter if you have other things to do, okay, until the RNs arrive or the charge nurse arrive. Okay, so what to include in the blood pressure is when it's high, it's okay, but when it's low, they want the map. So I don't know what your hospital's dyno map shows, but our hospital, the dyno map shows the map. The map is a parenthesis number below the diastolic. So you have the systolic over diastolic, then the map in parenthesis. When it's low, the nurse asks you what is the map reading. So you need to provide that too, because the doctor asks for that too. For some reason, if it's over 65, they're okay with that. So just don't forget to include those. And the heart rate, especially the heart rates too. Okay, so three things: heart rates, systolic, diastolic, and the map. Okay, so that's all I got today. If you have any question, you can comment below. Otherwise, have a good day, and I hope you don't have to report nothing today. Good day. Bless you. Heart rates and respirations. Okay, so that is during your vitals. Of course, you're not gonna sit at the nurse's station and watch the monitor, the heart monitor, and call the nurse. Yeah, that's not what I'm talking about. They have someone to watch that actually. It's called a telemonitor tech. And so they will do that for you. But what I'm talking about is during your vitals, okay? Because you will obtain those numbers, heart rates and respirations, along with your um, blood pressures readings. So for adults, because I work in the adult unit, so I'm going to talk about adults only. So for adults, for the heart rates, normal reading is 60 to 100 beats per minute. Okay, if it's faster than 100 per minute, it's called tachycardia. I'm sure you guys know that. So when why you want to report that? That's because tachy can cause patients to have shortness of breath, dizziness, fainting. Okay, and then end up with heart attack, of course. So you need to report that in real time. And for Brady, which is 60 beats or less per minute, bradycardic. Okay, so you report that because it can lead to, of course, dizziness, fainting, ischemic, stroke, which means blood blocked through the brain. So they'll have a stroke. Um, so I mean, not all patients come in with normal reading. Some they might have heart rates of 40, and the nurse aware of that. So, but then I'm talking about the patients who are, you know, just normal, uh, and when to report. So that's what it is. So for adults, 60 to 100. Okay. So past 100 per beats per minute, that's gonna cause heart attack. Less than 60 beats per minute, stroke. Let's just keep those in mind. We don't want none of that happen to the patients. Okay. Now move on to the respirations. This, like I said, this is not the patients. It doesn't pertain to the patients that's end of life or confirmation state. This is for regular patients, normal patients. The respiration for adults are normally 12 to 20. So for uh 20, if it's above 20, it can cause dizziness, muscle cramps, fainting, and could lead to lung disease, okay? Um, or lung damage. For the low respiration below 12, that can lead to dizziness, confused, and tired. So, uh, go ahead and report those again. Report them in real time, okay, before you move to the next patients, for patient safety. And that's why they're there. Maybe medication, maybe they're not feeling well. There's a reason that they have that kind of reading. So just to be aware of. And just remember to inform the patient. It doesn't hurt to over inform. Okay. So thank you for watching. Have a nice day. Feel free to comment if you like. And then if you feel that this is helpful, can hit the like and subscribe button, please. Thank you. God bless you.